Chapter 7 Neoplasia Part 1. In Part 1, we will be covering nomenclature and its classification and characteristics of tumor. So guys, when we think about neoplasia, the first ever thought which comes to our mind is three things. First, something related to new growth plus something related to tumor, that is mass of cells, and a process or a thing which is abnormal. These are the first thoughts or first thing which comes to our mind when we think about neoplasia. So you guys are right, but need some modification. So let's move toward introduction. First is neoplasia. What is neoplasia? Neoplasia means a new growth, and neoplasm or tumor is the product of that new growth. So you must be saying that everything which is new, everything which have a new growth is neoplasm. No, sorry to say, not all new growth are neoplasm. Example, see, new growth is very important for our life, for its continuation and normal functioning. First ever process which has new growth but is not neoplasm, which is not abnormal, is embryogenesis. A process by which every individual starts. A process in which the embryo divides and redivides to form a fetus. Then is regeneration and repair, a pretty much important process for our survival. Because if we undergo wear and tear, these are the process which helps us to function normally, to make that part which has undergo wear and tear function normally for further continuation of life. Then is hyperplasia. Whenever we think of hyperplasia, the first example which comes to our mind is pregnant uterus. I don't think that is abnormal. That is pretty much normal. Then is hormonal stimulation. I will explain this by giving an example of growth hormone. A hormone which affects maximum cells of our body to move towards the growth, overall growth of the body. That is not abnormal. So, the word which came to our mind, the one which is abnormal, is proper. New growth, tumor, and abnormal. Before moving towards definition, I would like to clear about three cells. Labial cells. These cells proliferates throughout our life, which undergo regeneration, which undergo repair. Infinite time, thousands of times it undergoes wear and tear, they proliferate. Then are stable. See, stable shows that they know what they want to do, what they have to do. They proliferate, but limited number of proliferation is shown. After that, suppose take a cell which divides only X time. After X division, X plus 1 division is not shown. They move toward permanent cell. Then what are permanent cells? The permanent cells are those which do not replicate at all. Examples are neurons, nephrons, which once undergone degeneration, once has undergone death, they do not replicate at all. So taking all these points in mind, we can conclude upon definition. What is definition? A mass of cell formed as a result of abnormal, excessive, uncoordinated, autonomous and purposeless proliferation of cell, which occurs even after cessation of stimulus of growth which caused it. Now the tumor or this mass of cell has two parts, parenchyma and supportive stroma. Parenchyma, it comprises of proliferation of tumor cells. It determines the nature and evolution of tumor. And the supportive stroma. It composed of fibrous connective tissue and the blood vessels. It provides a framework on which the parenchyma of the tumor grows.